everybody. This is Dr. Doty. I'm with contentforcars.com, and with me we have Dr. Jeffrey Kronk, and he is with Spinal Kinetics. He is the Director of Education with Spinal Kinetics, and I brought him here today on this podcast and on this video cast to share with the chiropractors here more about injury diagnostics, more about documenting the injuries and problems that patients that come into our office have, and how to better care for them. So, Doctor, if you would, Dr. Kronk, just talk a little bit about what you do and a little bit about your facility and what you guys are about.
Sure. First of all, I really appreciate you getting me on this interview this morning. It's amazing that you're in Romania, I'm in the U.S., and we can have these sorts of communications. The technology is just amazing. Spinal Kinetics, what we do as a company is we do a specialty radiographic reads for ligamentous injuries. When doctors have patients that have all kinds of various mechanisms of injury, and just to summate, mechanism injury is a force that causes a deformation pattern. So a burn causes a very specific deformation pattern. Most burn centers, if the doctor's been around for a while, they can look at the deformation pattern and pretty much tell you what kind of burn it is. Is it electrical? Is it chemical? Is it grease? Because they've seen it so much. If you looked at a bullet wound, that's a mechanism of injury. A dog bite is a mechanism of injury. The dog does not have to be present during the doctor visit for the doctor to start to assess the dog bite to determine, how bad is it? How severe is it? Is it severe? Is it moderately severe? Is it minorly severe? What we as doctors of chiropractic, or we as a spinal provider group, and actually there are other spinal provider groups, obviously the physical therapists treat spinal injuries, you have orthopedic surgeons, you have neurological surgeons, you have interventional radiologists. There's a lot of people who treat the spine. When we have a mechanism of injury, let's take, for example, a whiplash, which is a shearing type injury. Okay, it's a shearing force. That force causes a deformation pattern. That deformation pattern shows up as altered translations of the spine itself or altered angular patterns. So the spinal ligaments hold the spine in alignment under load.